So we understand, I mean, just looking from the Teddy Bear Foundation's perspective, we see where Department of Basic Education is coming from to reduce the incidence of teenage pregnancies and to, of course, overcome the statutory rape cases that we often deal with. But I think we need to have a two-pronged approach here, that prevention is essential, it is critical, and yes, the response which is reactive right now about holding people accountable. So awareness raising to accountability, one needs to follow that spectrum. And it is essential that different government departments come to the party and work together. So Department of Health, Department of Social Development, and Department of Basic Education need to work in coordination, in synergy. There needs to be collaborative efforts. If we just look at the issue around the youth, particularly children under the age of majority and children between 12, 15 to 19, the responses that are received at healthcare facilities are often very negative, and it is actually quite intimidating for children to go forward to seek any guidance, counseling on contraception. So people, healthcare professionals need to be trained, skilled and equipped, empowered to respond appropriately. Firstly, we find that they frown upon young children that come forward, and this deters children from seeking any kind of help and is actually contributing or feeding to the increased incidence of pregnancy. So that is something that needs to be also addressed. But in terms of Department of Basic Education, yes, age of consent, legal consent is 16 for both boys and girls. And the Children's Act speaks to Section 110, speaks to any incidents where there's suspicion, doubt or inkling of abuse, and in this case pregnancy has to be reported. So yes, it is important that it's reported, but I think we have to look at what is in the best interest of the child and maintaining that best interest, not only of the victim or the young girl who is pregnant, but also the partner that has been part of this process. So raising some kind of intervention, support, rehabilitation and reintegration. Reporting it and leaving it with law enforcement is not the solution. Yes, in cases of where there's educators, external people, adults, and of course children that are all partners that are much older than the victim, of course need to be brought to book regarding statutory rape.
And I wonder, Dr. Omar, you referenced the point about the stigma, right, that teenagers still face when they turn up at a clinic, either pregnant or wanting information that's related to sexual and reproductive health. Is the solution to base those services on school grounds?
Well, there's absolutely nothing wrong with that. If those services are decentralized, it would be accessible and available to all children. I think that is important. However, one can also appreciate the fact that this might deter some children because by attending those facilities, they would be labeled as being precocious or would be labeled as, behaving in inappropriate conduct. But, one needs to hear from children themselves. I think child participation is key. To have these top-down policies without engaging children on the ground and hearing what their worries, concerns, anxieties are all about, one will never be able to best provide or meet the best interests of the child.
You mentioned, for example, teachers who themselves are raping children and inappropriate relationships with them, it must be said. And if we're going to rely on schools to report cases of pregnancy on school premises and then to law enforcement to investigate, there is also the aspect where some of the other staff and even the principal may not move forward because of a compromised relationship that they too have with a colleague, a friend who is the teacher, who's the rapist in this case.
Indeed, absolutely. We've had cases where even principals themselves have been responsible for impregnating teenagers. So, it's again wanting to protect their best interests and not pursuing the best interests of the child, wanting to safeguard the school and the identity of the school, where sometimes material benefits or tokens are offered to say that this teacher or educator is one of the best maths teachers. We will not be able to replace this educator, and those kind of things, where children are then subjected to further trauma. They are intimidated and often not in a position to report because they know that they will not be supported, that it would be repudiated, and then the other thing is that it would then result in further victimization.
And added to that, Dr. Omar, is also the fact that sometimes when young girls are impregnated, some of them, out of shame and expecting to be shamed at school, then stop their studies, and that would then also not get us very far as trying to track down the perpetrator in this instance, wouldn't it?
Indeed. So what you are raising is so critical. I think the focus needs to be a holistic, comprehensive and integrated approach to learners, where we need to look at conscientizing, the awareness raising. It needs to be done on different levels, not only with learners, but even their caregivers and caretakers, parents, legal guardians, educators, even the school governing board. Everybody needs to be accountable and co-responsible. So this approach is, it might seem like the cure or for all ills in the school or regarding teenage pregnancies, but it needs to be very carefully planned and thought out before it's actually implemented.
Final question, Dr. Omar. I wonder if there's a link. We've spoken as well in the last few months about the high incidence rate as far as teenage suicide, if there is a link between that and these pregnancies.
So I can just speak to cases. And I'm not going to identify the neighborhood. I was there last Friday, where there were 15 young girls between the ages of 12 and 15 years. 3 of them came in with their babies not older than 6 months. And of course, one of them attempted suicide because of the humiliation, the shame, the stigma, and the fear of further reprisal from people around her. So this is a reality. We've seen numerous attempted suicides that have not been completed, but it is a threat to the well-being of teenagers who are in this predicament. And I think the whole objective is to create awareness and to protect young girls who are in this situation, who are in this crisis, and turn it into an opportunity where they receive support to continue their education and to be able to maintain the birth of a child that they're bringing into this world, and to ensure that protective services are made available to young girls in this critical situation.
Dr. Shaheda